Hello, I'm Dr. Nick, the Incrementalist, and today we're following up on our previous episode where we talked about cholesterol and what it is and why it's important to your body. This week we're talking about statins. So what are statins? They're molecules that impact the production of cholesterol in our body. And as we learned last time, it turns out that cholesterol, vast majority of which comes from production in the liver. And statins actually work on an enzyme, HMG-CoA, which is producing cholesterol in our bodies. And what we are able to do is to inhibit that, and that reduces the overall production of cholesterol, which is their intended effect. So we saw back in 1996 the first real sort of major emergence of a drug, one that most people will know as Lipitor, that's atorvastatin. An incredible positive effect on people's health in terms of lowering the overall cholesterol and really being very important in terms of reducing cardiovascular disease, because what we find is that those people that have high cholesterol in their blood is actually closely linked to atherosclerosis. That's the plaque formation in the body, and what we find in those plaques is there's a lot of cholesterol. So anything that reduces the cholesterol is typically helpful, and that's what these drugs are able to do. And why is atherosclerosis such a bad thing? Well, those plaques break off. Mild instances, what they do is they cause numbness and weakness in our limbs. Severe cases, that's what you have in terms of a myocardial infarction, when that clot breaks off, ends up in your heart, or in the case of your brain, a stroke. So we really want to prevent or reduce that cholesterol. So let's talk a little bit about statins and whether you should be on them. So should you be taking a statin? Well, that's a complex question. Like many of these things in medicine, it's not easy to give just straightforward guidance to everybody, but hopefully what I can do is give you some sense of making the right decision and how to go about making that decision. So the first thing is you've got to measure your cholesterol, so you need those numbers. You also need to have good insights into your medical history, your blood pressure. All of these things have an impact on that decision. The next thing you have to do, you can use some of the calculators that are online, so you get those values, you enter them in. That's based on scientific data, published studies from 2013 that essentially establish treatment protocols and levels depending on all of those factors. Those factors were updated in 2017. They became a little bit more aggressive on the blood pressure to really reduce the blood pressure because there's a sense that blood pressure should be as low as possible for the best cardiovascular effect, to reduce cardiovascular disease. So when you look at those calculators, make sure you understand whether it's using the updated version or the ones from 2013. Either way, understanding those decisions. But that decision is not as simple as, oh, I should just take it, should we put it in the water? One of the reasons for that is that these are not side effect free. It turns out that they cause side effects. There's some constipation, diarrhea. Many people know about the muscle cramps. That's one of the challenges. Certainly my brother had one, that particular instance. Good news, some of the newer statins actually reduce that side effect. So even if you have that, you may be able to still find one if it's appropriate for you. That's in about 5 to 10% of people. And then the other one that we've established through some of the papers is does actually cause a slight increase in diabetes. So certainly not something that you want to do. That's also associated with cardiac disease. So one of the things that we have to do is make sure that we don't cause disease. So it's not a simple question. Good news, there was a study, HOPE-3 study, that looked at some of this data and put about 12,000 patients into factorial groups that were treated with one of 3 treatments. ACE inhibitor, that's for blood pressure, like captopril, lisinopril, and so forth. Hydrochlorothiazide, that's a diuretic, and that's also a blood pressure medication. And then also statins, and there was a placebo. There were 3 actually published studies because of the multiple groups. And some great insights into that. Summary of that is, if you don't have blood pressure, you should be taking hypertension medication. It's not going to give you any benefit. With regards to statin, actually kind of interesting. If you have an intermediate risk, so that's one that's determined by your family history, all these other factors, then you pretty much should be on a statin and it's going to give you positive effects. So that's likely to be the case if you have an intermediate or high risk. And as far as the others, the combination is certainly good, and if you have hypertension, you should definitely be treating that. So incremental steps, make sure you get the measures done. So you need to know what your cholesterol is, and you also have to measure your blood pressure and have all of the other factors. And then take all of that, put it into the calculator. And then I would encourage you to go and have the conversation with your physician and take the data, take all of the information, and make an informed choice, whether it's appropriate for you. I'll put in some of the links to the calculators and some of the papers and the studies, and certainly the HOPE-3 trial. I think that's really interesting and well worth reading and understanding, and make your decision. If I could ask a favor, if you like this video, could I ask you to put it in the section below? If you didn't, let me know, leave me some comments, and if you've got some suggestions, this one was from one of my previous viewers who asked me to cover this, let me know too. Is there something you'd like me to look into and provide a report? If not, my name's Dr. Nick, I'm the Incrementalist. Don't let perfection stand in the way of progress.